Single mom nurses award stolen. What she built next shocked everyone. The envelope was already opened. Sarah Martinez sat in the hotel ballroom, her hands folded in her lap. After 5 years of double shifts, after missing her daughter's recitals, after saving 47 lives through quick thinking and steady hands, she watched someone else walk to the stage. Wait until you hear who they gave it to instead. Her 8-year-old daughter Emma held a handmade sign that read, "Go Mommy." Sign slowly lowered. The hospital administrator smiled broadly. This year's Nurse of the Year has shown exceptional dedication to our hospital community. Please welcome Katherine Foster. The room went silent. Polite silent, confused silent. Katherine Foster was the chief of medicine's wife. She volunteered 4 hours a week in the gift shop. She'd never worked a night shift, never held a dying patient's hand, never made a life-or-death decision at 3 in the morning. Sarah had done all of those things for 11 years. Was an ICU specialist, certified in trauma care, pediatric emergency, and cardiac response. She'd mentored 23 nurses, pioneered a new patient handoff protocol that reduced errors by 34%, and led the hospital's response during a citywide flood emergency. Colleagues had already been congratulating her. 17 different staff members had submitted her nomination. But politics doesn't care about patient satisfaction scores. Sarah clapped 3 times. She looked at Emma, whose eyes were filling with tears. She whispered to her friend Maria, "I need some air." She walked out the side exit. In her 15-year-old Honda, Emma asked the question Sarah couldn't answer. "Mommy, why didn't you win? You save people every day." Sarah wiped away a single tear. "Baby, sometimes people give awards to the wrong person, but that doesn't change the lives we've already saved. Those people still remember." "But it's not fair." "You're right, it's not. But we don't work hard for awards, Emma. We work hard because people need us." What she told her daughter that night became the principle that changed everything. Sarah didn't know it yet, but that moment in the parking lot was the beginning of something much bigger than any award. The next morning, Maria pulled Sarah aside in the break room. "You don't know, do you?" "What?" Maria hesitated. "Dr. Foster is on the hospital board. He pushed for Katherine to win, threatened to pull funding from the nurses' training program if she wasn't chosen." Sarah's hands stopped moving. "Katherine needed it for her country club application," Maria continued. "She's never even spoken to most of our patients." Sarah was quiet for a long moment. Then she said, "Thank you for telling me." "Aren't you angry?" "Furious, but patients in beds 4, 7, and 12 need their medications. My anger can wait." But Sarah didn't ignore her anger. She transformed it. That night, after a 14-hour shift, Sarah didn't write a resignation letter. She didn't call a lawyer. She didn't post an angry message on social media. Instead, she texted the local nursing school, "Is your offer to teach evening courses still available?" The response came immediately, "We've been hoping you'd say yes. When can you start?" Over the next 18 months, Sarah did something unexpected. Kept her hospital job, but she also started teaching 2 evenings a week. Her course was called Patient-Centered Care for Limited Resources. 40 students enrolled immediately. Then she partnered with a community health center in an underserved neighborhood. She trained nurses, EMTs, and community health workers using techniques she'd developed from years in the ER. Students started implementing her methods. Patient outcomes improved measurably. Local news covered the innovative training program. Other hospitals asked about her curriculum. While Katherine was framing her award, Sarah was changing thousands of lives. Meanwhile, back at Metro General Hospital, something was happening. Nurses started leaving. First 1, then 3, then 14. All of them moved to organizations that Sarah had trained or influenced. All of them said the same thing in their exit interviews. if Sarah Martinez isn't valued here, what chance do we have? Within 18 months, the hospital had lost 23% of its ICU nursing staff. Patient satisfaction scores dropped from 87% to 64%. Medical errors increased by 28%. The hospital was facing a crisis. Then came the inspection. The Joint Commission delivered their report. Metro General had 90 days to show dramatic improvement in nursing protocols or face loss of accreditation. At the emergency board meeting, someone finally asked the obvious question. Where are all our experienced nurses going? The HR director pulled up a report. Organizations using something called the Martinez method. A board member looked confused. Who is Martinez? Long pause. The nurse who didn't win the award. The hospital that had ignored Sarah was about to come calling. Administrator called her directly. Ms. Martinez, we'd like to offer you Director of Nursing Excellence, $175,000, full authority over all nursing protocols. Sarah was quiet for a moment. I'll consider it, on one condition, I meet with the full board in person. 1 week later, Sarah walked into the boardroom wearing the same simple dress from the award ceremony. Carried a manila folder. 2 years ago, she began, I watched someone receive recognition for work they didn't do. I could have sued. I could have made this very public. Opened the folder. Instead, I did this. The projector showed her results. 60 nurses trained, 12 hospitals transformed, patient outcomes improved by 40%, 3,000 patients served who previously had no access to quality care. You're offering me a position I don't need anymore, so let me make you a different offer. Her terms were simple but revolutionary. Awards decided by peer review, zero tolerance for nepotism, nurses included in every policy decision, and Katherine Foster's award would be redesignated as Community Volunteer Award, because that's what it actually was. A new award would be created, named after Sarah's late husband, the Marcus Martinez Excellence in Nursing Award. Chosen by patients and staff, not politics. The board voted unanimously to accept. Except one person didn't raise his hand. Dr. Foster. This is absurd, he started. The board chair cut him off. Richard, you're recused, conflict of interest. The vote passed 11-0. After the meeting, Katherine Foster was waiting in the lobby. Sarah, can we talk? They sat down. I've been in therapy, Katherine said quietly. When I saw the news stories about you, something broke inside me. I took something that wasn't mine, and I thought I deserved it because of who my husband was. Tears filled her eyes. I'm so sorry. Is there any way I can make this right? Sarah looked at her for a long moment. The community health centers I work with need volunteers. Real volunteers, not for awards, for impact. 4 hours a week, show up Monday. Katherine nodded. I'll be there. She was, every Monday after. 1 year later, Metro General's nursing retention rate was 94%, the highest in the state. Katherine had enrolled in nursing certification courses. Emma stood in front of her 5th grade class for career day. My mom almost won an award once, Emma said, but they gave it to someone else, and my mom says it was the best thing that ever happened. Showed photos of the nurses her mother had trained. If Mom had won, she would have helped hundreds of people at one hospital. Instead, she's trained 200 nurses who help thousands. Emma smiled. My mom says sometimes you lose what you thought you wanted so you can find what you were meant to do. Sarah's program has trained 800+ nurses across 15 states. Katherine completed her nursing certification. Emma is now pre-med. The award sits in storage. The lives saved are everywhere.